Hello. So today we have Brendon with us. How you feeling, Brendon?
All good.
Yep.
Yeah.
So Brendon is our renowned hairdresser. He does Kiran's hair for her. But anyway, so Brendon, beautiful face already. Doesn't really need much. What we want to do is just a little bit of more restoration work. You mentioned yourself, you didn't really like the lateral point of your eyes. Yeah. So we can see in the light here how there's volume loss across the lateral orbital here. So it dips in. And this would give the appearance of looking a little bit tired. The fat pads under the eyes have herniated. And we can see if we put the tip down and then just look up to the ceiling, we can see that infraorbital crease across the medial aspect of the eyes and then the lateral point here. So what we want to do today is address all of this that is normally neglected. I see a lot of people just address medially and then leave all of this area. So we want to make sure that we address that. Now, this over here looks like an edema. So an edematous sac that retains fluid. The orbicularis oculi, it's a sphincteric muscle that closes. While we blink throughout the day, we're draining the fluid. When we go to sleep, the fluid builds up, and especially around here. And so it looks more puffy in the mornings, and throughout the day, as you're blinking, it will lessen. What we have to be careful of is if we're doing Botox, we can inject here and here, but we wouldn't go down here. Because if we modulate that area and stop the contraction, it will no longer drain fluid, and this will look worse. And Brendon will not forgive us for that, so we've got to be careful of that. So today we're just going to smoothen out the eyes. We're going to be using preferred product of choice. It's the Density 2, best product I feel on the market for doing tear trough. And then we're going to do the nose. So again, nose, perfectly fine nose. I like the width. However, we can see if we look in detail here, just a shadow that goes across here, and then it comes out more lateral, the more superior we get. So I really want to fill this area in and make it look more straighter. And then with the side of the nose, I want to make the projection higher. So I want to give a bit more of a tip. So we're going to put the tip roughly around about here, which will help to then just shorten the nose and also create a much better side profile. Brendon was thinking possibly about surgery.
Yeah.
And I think he's got a perfectly fine nose. I don't think he needs surgery yet. Start just above here. So if you look up to your ceiling for me. As you can see, it looks a little excessive when we first do it. Creates a little lump underneath. And then we just mold that and smoothen it out. Very, very small little droplets. Now the filler wanted to come out, so he's going to move the skin around here, make sure it envelopes around. Again, now just do some molding. We're moving medially. You can see it's very little volume medially, especially on this side. This side's a little bit worse. So I'm going to be doing micro droplets like this, like that, Brendon.
Yeah.
Look, just very tiny little droplets, just to build it up, and we don't want to overdo it. So as we know, tear trough is one of the most problematic areas, and a lot of clinics don't do it. The reason we do it is because personally, having tear trough for me, it's quite life changing to my confidence, to everything. So I think it's one of those, if you can master it and understand it, obviously you still may have some issues, but it's about rectifying it, working with the client and making sure that you or committed to getting the best result. Sometimes that might mean doing less to start with and then building up slowly. Sometimes that might mean if the client retains fluid, and that can be down to diet or stress, then you might have to dissolve a little. But you can get a really good result with filler as long as you're using a minimal amount. So you can see here, and if you compare that, so if you go to there, we compare the two. You can do a little bit more natural to your people. You might notice that we're not using cannula. And the reason why is because you just don't get enough precision. I think with cannula, I have a lot more problems with it. Yeah, it can prevent bruising, but as you can see, it's very little bruising, generally anyway. But when you have a client that has a very deep tear trough, then you have to go in quite a few times. It can cause bruising. You really can't get cannula effectively around this area, the lateral canthus, and you can't get it onto bone. It's very difficult to get it right onto bone. Whereas with a 30 gauge needle, you've got precision. All right, just turn here. Look at the difference there. So I'm going to do a little bit more around your eyes, a touch into your nasal labia folds, and then I'm going to show you so you can compare the two sides, so you can really get a good appreciation. I don't want to chase this line because we don't want projection here. Close to that transverse artery around here, the one that supplies the blood to the mid cheek. So we want to make sure that we do an aspirate and we're onto the bone. Yeah, and I'm just going to mold that now. That good strong mold. So 0.2 cc's just there. And now we're going to just go a little bit more superficially. Again, important to aspirate. We don't want to do too much in this area. And if you notice, I'm not doing a retrograde deposit. I'm not doing a linear thread. And the reason for that is, if you come to zoom in, let's say the artery is across here. If I do this and I aspirate, I might not be in the artery. But when I inject and I'm coming out, and I do this, I then deposit into the artery. So that's why I like to do perpendicular and small micro droplets there. There you go. Perfect.
Oh yeah, it has made such a difference, isn't it?
Mm-hmm.
Even that there, like considering what that was like.
Yeah, so it's very subtle there. But yeah, look at the difference. Look how long that goes down, and there's so much more deeper. It's almost like a snarl there.
Yeah.
And you're happy here.
Yeah. It's really good.
And then the eye is really fresh. And just imagine this is still with trauma. So imagine when it's all settled, it's going to look so much better.
Yeah, that looks so much better there now. Because that's what my main concern was, like this hollowness there. Yeah, it looks really good. Does that look younger?
You look really good, refreshed.
Yeah, just younger, fresher, and
That
actually
hollowness is just
less angry.
Yeah.
That actually, when you see the ideal role for a villain, they will always have a very deep nasal labia before, so it looks like they've got a good snarl. And yeah, you look friendly.
Yeah, it has.
Fantastic.